And now I'm going to turn our lesson over to Lynette Wilson now. Take it away, Lynette.
All right, give me just a second to get the screen share up. Okay. As Pat said, the topic for today is help. I think my loved one is sick. I have felt like both of these people in this picture at various points in my journey with my husband with dementia. And I'm sure you have too. But one of the things that we think about today, the first thing that comes to mind frequently when we think about someone being sick is COVID-19. But there are other things that probably are more likely to happen to your loved one with dementia, because most caregivers are being very careful to stay away from others, to not put themselves or the person they're caring for with dementia in a situation that they will be exposed. So not that you can't get COVID or your loved one can't, but the chances of that are probably actually lower than some of the other illnesses that can happen with dementia at this point. I want to start out by talking about general changes as we age, because these changes make a difference in what we get in terms of illness and how our body responds to it. The first thing is that as we age, we have a general decreased immunity to illnesses. There's a cell in our body called a T cell, which is the cell that actually fights viruses, bacterial infections. The production of that cell decreases as we get older, so that there's not as much of that cell available to fight invasions into the body. The other thing is that that cell also means, as there's less of it, that it takes us longer to recover from illnesses, because our body does not fight it as well or as quickly. The second thing that's important to remember is that as we age, we're not as likely to respond to illnesses with a fever. It's easy when you look at a child to know that they're sick because you turn around very quickly and their temperature's 102. That's not what happens with an adult in most instances. An adult has much less fever, and for someone with dementia, they may have even less fever than a usual adult would have, because the dementia represents a brain that is deteriorating and that the brain functions are not going as well as they normally would. So there may be little or no fever even with a very serious illness. The other thing is that most of us as we age have some kind of chronic illness, and sometimes the symptoms of an acute illness can be similar to or confused with symptoms that may be caused by that chronic illness. An example of that would be a person who has chronic obstructive pulmonary disease or COPD, who may have trouble breathing, and at times that is more difficult than other times. How do we know that that is not pneumonia or perhaps not COVID-19 at this point in time? Because the symptoms can be very similar. The other thing that is an example of this is thinking about people with high blood pressure or with chronic inner ear infections. Either of those people can sometimes have bouts of dizziness. And dizziness can also be a symptom of irregular heartbeat. So which is going on? The irregular heartbeat may be a more acute change that needs to be taken care of than the blood pressure, if it's stable, or the chronic problems with inner ear. There's some additional challenges that we have in trying to decide what's going on with the person with dementia, besides the ones I've already mentioned. One is that a person with dementia may not be able to describe how he feels, which helps us understand how sick he might be, may not be able to answer questions, either for you or for a medical care provider. They may not perceive pain in the same way, again, because of those alterations in brain function that are there as a result of the dementia. And they may not remember how they usually feel to be able to make a comparison. Many times when we're trying to decide how ill someone is or whether they're getting better, we ask them, well, how do you feel today compared to yesterday? And with short-term memory loss, that may be impossible for the person with dementia to make that comparison in any way that's meaningful. So, how do we know there might be a problem then? The things we typically will look for are decreased appetite, and this is still different. Sometimes people with dementia eat better one day than another day. You know the person that you are caring for. So this is appetite that's decreased beyond whatever pattern you typically see with that person. The same is true of the energy or activity level. Again, it's longer lasting or it's more significant than what you typically see with this person, as is the need for sleep. Increased sleep can be an indicator that there is a physical problem. Again, compare it with what you typically see. One of the biggest indicators that there might be a problem in someone who has dementia and is otherwise asymptomatic is that you might see changes in their behavior, which include increased restlessness and, in some people, agitation. These are the signs for many people and many families that the first thing that you think about is, does this person have a urinary tract infection? Urinary tract infections are one of the most frequent infections that occur in older people, and in particular in people with dementia. And sometimes the restlessness and agitation are the only symptom that you will see of that. The other thing that might happen is something called delirium. Delirium is a little different from just increased restlessness and agitation. It's usually a very rapid onset, days, or in some cases just within hours somebody changes. They have very acute confusion, hallucinations, delusions, and agitation. Delirium is typically considered a medical emergency, so it is something that, as we talk about how you might approach taking care of suspected illnesses, we'll talk a little more about those emergency situations. Okay, how do we talk to healthcare providers these days? Most of us are probably, if we haven't had participated in a telehealth visit, either by phone or computer, know somebody who has, or know that our insurance company is now paying for that. Medicare is now paying for telehealth visits. Some are done by phone, as I said, and some are on the computer. I have done both of those kinds of visits. I actually prefer the computer so I can see the person, the medical care provider, and feel like we have a little more discussion than a telephone call. But which is available to you may well depend upon what your provider's offering. Regardless of which one is available to you, the number one thing to know is how to use the equipment. That may be even more so with the computer. And if you don't know how to do Zoom or other computer video conferencing. If you have a grandchild who's a preteen or a teen, I'll bet they can show you. If not, someone else in your family or your friends can walk you through that process and help you with it before you actually have a visit. Be ready if you've got a telehealth visit for the appointment to start right on time. Both Pat and I have had telehealth visits during this period of COVID isolation. And one thing that is very striking is that if you have a time of 2 o'clock for the visit, that's when your medical care provider's there, ready. There seems to be much less lag in moving from person to person when it's telehealth. And so you need to make sure that you're ready exactly on time. Before you have your telehealth visit, make sure that you make notes about what changes you're seeing in your loved one and what concerns you have. It's too easy to forget to say something when you're in the middle of a conversation, and sometimes the thing you forget to say is the one thing that would have made a difference in the decision about what to do for that person. Likewise, you need to prepare any questions that you want to ask in advance. Obviously, your first and foremost question is there something, do you think there's something going on? But there are other questions you need to think about. If there is something going on, what are we going to do to treat it? How are we going to manage this without creating more problems for this person with dementia? Consider having someone to take notes during the conversation, especially if you're dealing with a computer and newer technology for you. It's really hard to concentrate on your conversation with the provider, whether the technology is working correctly or not, and what the person's saying back to you in terms of remembering it precisely for later. Having someone to take notes can be as simple as maybe another member of the household doing that, or even a neighbor or a friend who could come in. It's pretty easy in most instances to social distance from a person who is taking notes, because they certainly will be able to hear any audio on your computer, or if you're using the speaker option on your telephone, to hear what's being said. Ask your medical care provider what you can do to avoid going to the doctor's office, urgent care, or the emergency room. This is really, really important for a couple of reasons. One is obviously, again, with a pandemic, you don't want to expose your loved one to something that might be dangerous for them. But secondly, visits to doctor's offices, to urgent care, and especially to emergency rooms are very, very difficult for people with dementia and very confusing for them. And that is only compounded if they already don't feel well. Remember, as you talk to the medical care provider, that good healthcare providers are interested in your concerns and in your observations about the person, and not totally reliant on what that person can tell them or not tell them at this point in an illness or a suspected illness. So, if an in-person visit is absolutely unavoidable, what do you do? Ask ahead of time if you can provide any updates to personal information, insurance information, anything else that has to be updated regularly before you have the actual visit. That means you will have less time in the office. That's less time out of your time, leaving you free to be with the person who has dementia. But also you have to think about the fact that that person may not do well with a mask and may not do well or understand social distancing. So anything you can do to cut down on the amount of time that you have to spend in the office will be very helpful in the long run for both of you. Make your case for staying with your loved one when you're having to schedule an appointment. It's really important that you be able to stay with your loved one while they have an exam. This is particularly a problem with visits to emergency rooms right now. What I would suggest, if you end up having to take someone with dementia to the emergency room, unless it's an acute emergency where they can't get their breath or they've had a seizure or some other significant event that you've got to move right then, my suggestion is that you call the doctor who's on call for the primary care provider for your loved one. Usually there's somebody on call for that office after hours. Talk with that person about where you need to go. They may be able to help you work through an alternative besides the emergency room if it's after hours. But also a medical care provider is the best person to be able to say to hospitals or urgent cares, we have to not follow the rule for only one person coming in, i.e. the person that's sick. This person has to have a family member with them. The other thing is, if you're going to an office or to an urgent care, ask if you can stay in the car until it's time for you to actually move with your loved one into an exam room. Again, they will be more comfortable in the car. They won't have to have a mask on. You won't have to worry about social distancing. And it should be no problem for someone within the medical setting to simply give you a phone call and say that they're ready to see that person. I hope these suggestions will help you as you think through the inevitable times that we all encounter with our loved ones with dementia. Many of these suggestions also apply when we're not talking about a pandemic. Just because visits to medical care providers and particularly emergency rooms are so upsetting for people with dementia. Thank you for your time, and we will see you later.